Hello, and thank you for joining today's webinar on how to reverse your neuropathy symptoms. Hi, I'm Dr. Jason Tripp, owner of Tripp Chiropractic. I am board certified as a chiropractor. I also have a diplomate in clinical nutrition. I'm board certified in integrative medicine, and am a fellow of American Association of Integrative Medicine. I also have advanced training in and a certificate in treatment of neuropathy. We've been helping patients with neuropathy for the past 27 years, and recently we're getting a lot of inquiries about this condition. So, we put together a brief presentation to address some of these questions and explain what neuropathy is and how it impacts your life. Today, you'll learn a good deal of information as well as how our patients have regained control of their lives with this approach. So, watch to the end. And if you have specific questions, which I haven't covered, write it down, and you can ask me virtually or even better, in person during your consultation. First, I'd like to ask, are you happy with your health? The reason why I ask is because that's how you're supposed to feel. You should feel good when it comes to your health. Chances are you're watching this, you're seeking a way to do just that. Again, to feel good about your health. Research shows that 90% of neuropathy sufferers are relying on drugs to manage their symptoms. But we all know this isn't the most ideal long-term solution. What if I could offer you an alternative, a treatment that could improve your neuropathy by 60 to 90 or even more %? Would you be open to that? The protocol we use has helped thousands of patients across the nation who've been in your very shoes. They've suffered with neuropathy for decades with no hope in sight. At Tripp Chiropractic, we offer a proven protocol that's been highly studied and FDA cleared. It's offering actual results, and it's highly studied and proven method that's non-invasive, uses no drugs, and is designed to help your body heal itself. Take some time to look at our patients who've experienced our method with tremendous results.
Okay. I heard about Dr. Tripp's office, so I thought I'd give it a try. And I came in, I had a problem with neuropathy. It got to the point, progressively got worse until I couldn't get any sleep anymore. It kept me up at night. So I decided to come in and set up a plan. And I started coming in, and the staff was real nice and got to know the staff real well. And as it is right now, I feel 80% better with my neuropathy. I hardly have any neuropathy at all. Maybe a little bit in my left heel. But the staff is really nice here, and I'm going to miss them when I leave. And I had osteoporosis, so I can't get regular treatments, but I get the other what's possible, and my back feels better, my neck feels better. And I'm glad I came. I'm glad I made the choice to come.
Well, when I first started coming here, my feet were burning so bad I couldn't hardly stand it. I'd have to either put them in cold water or walk on a cold surface. But now, since I've been coming up here and getting treatments, the pain is completely gone. I don't have the burning anymore. And I feel so much better that I can go out and not have to worry about my feet killing me walking around. And he's taking care of everything. And I feel 100% better than when I started here.
Peripheral neuropathy, usually referred to as neuropathy, refers to damage, malfunction, and even death of the nerves in the body outside the brain and spinal cord, usually located close to the surface of the skin. Peripheral means that which is at or near the perimeter, like your hands and feet. Neurons means nerve. Apathy means pathology or sickness. So neuropathy means pathology of the nerves. The most common nerves affected are the peripheral nerves. These are the long nerves that extend to the end of the fingertips and down to the tips of the toes. You may have symptoms like burning, numbing, tingling, cold, cramping, feeling like ants are crawling on you, or feeling like your socks are bunched up. Or maybe you have balance issues or restless leg syndrome that makes it hard to sleep. Neuropathy can be a painful condition that can have an effect on your ability to maintain your activities of daily living. Peripheral neuropathy is a disease afflicting 20 million people in the United States. That's 1 out of every 17. Most are over the age 45. Peripheral neuropathy comes about from many different causes, also known as risk factors. They are divided into 3 categories. They include metabolic, in other words, chemical or nutritional, mechanical, which is caused by compression of a nerve, or idiopathic, which just means unknown cause. Actually, there's over 100 causes of neuropathy that fit in this category. Each of these creates its own set of unique challenges for those who suffer the disease. I had a doctor friend of mine, out of state, who was doing a consultation with a neuropathy patient when his next neuropathy patient drove into the front of the office. She couldn't feel her feet and pressed the wrong pedal. She drove right into the front of his office, literally breaking down the door, all the bricks on both sides. Wow. Luckily, no one was hurt. The bad news is, this is a common occurrence around the country with severe neuropathy sufferers. They slowly lose control of their lives. Traditional treatments for neuropathy over the years have offered little help to no relief for patients suffering with this debilitating disease. Why are conventional treatments so unsuccessful at treating neuropathy? Well, it's quite simple. Conventional medical treatments focus on treating only the symptoms of the disease and not the cause, which is a lack of circulation in the nerve. Interestingly, most drug treatments for neuropathy are not even intended to treat neuropathy, but they're actually designed to treat other conditions. For example, Neurontin or gabapentin is actually an anticonvulsive, which means it's designed to treat seizures. The way it works is it slows down your brain so you don't feel your feet. Elavil or amitriptyline or tofranol or Cymbalta are antidepressants. Pregabalin or Lyrica is designed to treat fibromyalgia, shingles, depression, or spinal cord injury nerve pain. None of these drugs on the market address the true underlying cause of neuropathy. The reason is loss of blood circulation, which reduces the nutrient and oxygen flow to that nerve and results in damage. Unfortunately, peripheral neuropathy is rarely corrected with these drugs and medications. At best, they may temporarily relieve some symptoms. The flip side, though, leaves many with a host of unwanted potential dangerous side effects, which can suppress the immune system function, liver, kidney, stomach, kidney failure, increased risk of kidney dialysis, or even suicidal tendencies, to name a few. Let's look at how we treat our bodies from a different perspective. Did you know we sometimes treat our bodies worse than we would our very own car? Think about that for a minute. If your check engine light came on while you were driving, what would you do? You'd get it checked by a mechanic, right? Well, once they pinpoint the exact problem, they would fix it. You would notice the check engine light would disappear because the internal problem has been resolved. What if instead your check engine light came on and you took it to the shop and asked the mechanic to just reset the light for you so it doesn't bother you again? That would be counterintuitive, right? But that's exactly what's happening with our pain when we're avoiding addressing the underlying cause and just taking medications. Once it wears off, the unbearable pain, numbness or tingling or other symptoms just keep coming back. So when you next experience balance issues or burning in the feet or electrical shock pain, if the bottom of your feet feels squishy as if you're wearing socks when you're not, or if you're having sharp pains or cramping, this is a similar sign from your body as if your alarm system is going off. Ignoring this is like covering the check engine light so you don't see it anymore. But what's really happening is the underlying problem just keeps growing until it reaches a point of no return. This is exactly what we do with our health. While medication is a useful tool, there's a time and a place for it. But putting a bandage on neuropathy and masking it will get you to the point of no return. Eventually, what happens for some is they won't be able to walk. Some patients start to fall due to balance problems. Eventually, it might get so bad it's not even treatable anymore, or even end up in amputation. So you're probably asking, well, what's the answer? Well, the key lies in assisting the body to do what it's already naturally designed to do, and that's to heal itself. This approach has been around, well, forever. There's a quote by Thomas Edison, who had over 1,000 patents and discoveries, pretty famous guy. He said the doctor of the future will give no medication, but will help his patients with care of the human frame, but would rather cure and prevent disease with nutrition. This is a very profound quote, and it's an idea that's been obscured over time. As reliance on drugs and surgeries and injections grows, we're not actually curing chronic conditions. Do you believe that your body can heal itself? If given the proper tools, we restore nerve function and health by healing from the inside. Your body does the work. Our comprehensive approach to treating neuropathy ensures we see the best outcomes because we're addressing the body as a whole. For us, to put the body back into its optimal position, we use a series of comprehensive treatments to help the body to heal itself. If you're a little skeptical, that's perfectly normal. You're probably wondering, how does the human body know how to heal itself? Well, let me give you an example. Let's say someone breaks their arm and they need a cast. Does the cast heal the arm or does the body? Let me give you another analogy. Suppose someone cuts their hand and needs to have stitches. Does the body heal the cut or do the stitches heal the cut? It's the body, right? That's what we do with neuropathy. The protocol was developed with tons of research using the newest cutting-edge technology to treat neuropathy. What we found is by approaching neuropathy from 3 very important angles, 1, metabolic, 2, musculoskeletal or mechanical, and 3, neurologic. 90 to 95% of our patients are experiencing great results. What's great, you may ask? Let's say you have 60% nerve loss, and you could restore most of the function, taking it down to about 10 or 20% loss. I'd say that's pretty great. I will say that some of our patients even get more than that. If your pain was diminished from a daily nuisance to nothing, if your numbness got better, if your balance got better, and most importantly, if you're able to do things that you had to stop doing because of your condition, would you consider that great results? So let's elaborate into what that means. Neuropathy is a condition that requires a comprehensive approach to treat all the damaged areas. I have developed a 3-part system that works to treat neuropathy and its symptoms. It's called the Tri-Well system. In other words, 3 steps to wellness. I developed the 3-step system because I was suffering with neuropathy. Let me tell you a little bit about what happened to me. In 1988, I had a severe auto accident. I ended up with 7 bulging discs. Those bulging discs put pressure on the nerves that went to my feet. My feet didn't feel bad at first. Later, the symptoms started every now and then. It didn't seem like much, but over time it grew until I was really feeling it in my feet. My feet were burning practically all the time. I had to take my shoes off between patients because the burning was so bad. The way neuropathy affected my nerves, I also had restless leg syndrome. That made it almost impossible to get a good night's sleep. Have you been suffering with your sleep? You know what I'm talking about. I had to find a way out of this. When I started hunting for answers to help neuropathy, I found out that nutrition and metabolic balance plays a major role in whether your feet heal or not. Even though I had always tried to eat good, I got tested to be thorough. When I tested to see if I had any deficiencies, in other words, lack of nutrients, calcium, magnesium, potassium, etc., to my surprise, I had several deficiencies. Apparently, my body was not absorbing nutrients. As I studied, I found out heavy metals may have a negative effect on the body. One of them is to block the absorption of nutrients, and I thought, aha, maybe this was my answer. So I got tested right away. And again, to my amazement, I had heavy metal poisoning that blocked nutrients from absorbing into my system. I knew this could lead to other problems, so I continued testing to find out what was going on inside my body that allowed the neuropathy to develop. I had heard about inflammation and how bad it can be and how it's really bad for the body. I read the Time magazine article several years ago that listed it the top 10 killers, heart disease, cancer, diabetes, you know the ones. And the article talked about inflammation was actually the cause of 7 out of 10 of those. Yes, 7 out of the top 10 killers in America right now are caused by inflammation in your body. I'd say inflammation is a pretty important thing to talk about. We all know about the inflammation in the body when we get hurt. Pain, tenderness, or after injury is normal. Short-term inflammation is good, natural part of our immune response, basically as a response to perceived threat. This type of inflammation helps rebuild tissue, eliminate invaders like bacteria and virus. But chronic inflammation, that's the real problem. Chronic inflammation occurs over long periods of time, usually at low levels that aren't visible to the naked eye or even to routine blood tests. You may never realize you have it. Over time, chronic inflammation can damage healthy tissue. Ongoing research has found that chronic inflammation is a major player in many of the most prevalent diseases in our country. The most common place inflammation will come from is a bad gut. When the gut is functioning improperly, it can lead to inflammation, which can lead to leaky gut, which can lead to the body developing food sensitivities. So I got tested for food sensitivities to see if that was my problem. Turned out I had 72 food sensitivities. You've heard of gluten and dairy sensitivities. Well, I had 72 of my favorite foods that I was sensitive to. Had to change everything. I was really having a struggle with this inflammation. Apparently over time I developed a lot of inflammation in my gut, and it caused leaky gut and allowed all these foods to become sensitive. So much inflammation led to other problems, pains, and even diseases. I ended up developing several conditions. I'll tell more about that another time. So I developed a severe neuropathy. I'd been studying and training several years to learn how to reverse neuropathy. I eventually got a certificate in training on how to help reverse neuropathy. I not only helped myself stop suffering with neuropathy symptoms, and helped thousands of others who've had to suffer with neuropathy symptoms to finally find relief, just like I did. Let me discuss each part specifically about our program. The first part of our treatment is called low-level light therapy. Low-level light therapy uses infrared light to stimulate a process called angiogenesis. Angiogenesis is the creation of new blood vessels from pre-existing blood vessels. You can see a picture as an example. You see a nerve with little blood supply. Right after angiogenesis, that blood vessel expands and grows in another set of blood vessels, which is exactly what the nerve needs to repair the damage. Here's a real picture of angiogenesis on the left. You see a nerve with barely any blood vessels. That's the control. On the right, you see a picture of a nerve with lots of blood vessels after treatment with low-level light therapy and VEGF, which is a protein that stimulates angiogenesis. You have this in your body too. There are studies on low-level light therapy that support its safety and effectiveness. Light therapy can reduce pain, improve immune function, speed up wound and fracture healing. It increases production of DNA and collagen, the building blocks of the tissues. It increases the activity of fibroblasts, what our cells' connective tissue is made of. All those things are necessary for the wounds and injuries to heal. Low-level light therapy has been FDA cleared for treatment. The second part of our treatment plan is re-educating the nerves. When nerves get sick and start dying off, they forgot how to work properly. So we basically rehab them and teach them how to function properly again. We use 21st century technology that's been being used at the cancer treatment centers of America. The reason they do this is because chemotherapy can also damage nerves. They get great results, and so do we. This is different from TENS. You may have heard about that before. TENS units are just for pain management. But we use a more advanced and updated technology to actually re-educate your nerves. Our patients love it, and we get great results with it. We speak the language of the nerves. So what does this mean? We use low-level light therapy to stimulate angiogenesis. In other words, bring more blood supply to the area. We use cutting-edge digital electroneurotherapeutics stimulator to help the nerves stop hurting and retrain them to function properly. And this is possibly done at the comfort of your home, so you can get your healing started in a convenient way. Third part of our protocol is a nutritional protocol that's developed specifically for neuropathy. We start with our TriWell 3-step testing protocol. I described it earlier. The first testing protocol is designed to find out if there's excessive inflammation coming from how the gut is functioning. If there's a lot of inflammation in the gut, it can lead to leaky gut and food sensitivities. In today's fast-paced world, things like stress, too much sugar, a diet low in fiber, excessive drinking, or non-steroidal anti-inflammatory drugs, which is NSAIDs, food sensitivities, all lead to leaky gut, which leads to inflammation from basically effectively blocking nerves from healing and allowing neuropathy symptoms to grow. So far, we have tested our neuropathy patients. 100% of the time, every neuropathy patient we've treated has had enough inflammation that they've had at least one food sensitivity. Most didn't even know they had it, but when we tested them, they all had at least one. So we want to test and make sure do you have a food that your body is sensitive to that eating it will actually cause your feet to get worse? Second test is to take a look at toxicity in the body. One type of toxicity that could be in the body is heavy metals. I had heavy metal poisoning from drinking water. Wow. Some heavy metals include lead or arsenic or mercury or aluminum. There are many. If you have these metals in your system, it can block the absorption of nutrients, making it harder to heal neuropathy. So we want to test and make sure, do you have heavy metals that is blocking your absorption or causing other symptoms? The third test in the system is looking for nutrient deficiencies. If you're lacking proper amounts of calcium or potassium or magnesium, it's harder for you to heal your neuropathy symptoms. You need the nutritional building blocks to give your body what it needs to heal. We believe that it is necessary to get rid of what is causing the intestine to be compromised and seal off that area so toxins, virus, bacteria, and other foreign invaders can be cleared and safely removed without anything reoccurring into the bloodstream because of the unsealed gut. The same principle applies when we're rebuilding the intestines and adding good flora and nutrients back to the body, which leads us to the third part of the protocol for neuropathy healing. The third part of our protocol is the nutritional protocol that's specifically designed for neuropathy after you have your testing. There's a natural vasodilator that opens up the blood vessels. It's called nitric oxide. And you need this to keep the body flowing in these tiny little blood vessels that nourish the nerves. However, increased amounts of sugar, starches actually decrease the efficiency of nitric oxide. And the typical American diet is full of these high sugar, high starch foods. This, of course, leads to decreased blood flow in those tiny little blood vessels that those nerves rely on for their nourishment and nutrition. Sugar and starches can also create inflammation in the body, which further acts to decrease blood flow. We address all this in our nutritional protocol that's specifically designed to treat neuropathy. But don't worry, there are thousands of patients that do this every day. It's easy to follow and fun, and you can totally do it. Your blood vessels are like tiny pipes. When you decrease the size of the pipe, less can flow through. When the blood vessels are given proper environment and assistance in the natural levels of nitric oxide, they become dilated or open up, meaning the interior of the pipe has expanded and more blood can flow through. This is what we want because we want to bring more blood flow to those little nerves so that they can get the nourishment that they need to heal. We give our patients some natural products that they help the body produce nitric oxide. The idea is that it's going to lead to more dilation of the blood vessels and more blood flow to the areas that need it. The scientists that discovered the importance of nitric oxide regulating blood flow actually won a Nobel Prize in 1998. We found that we really need to take a comprehensive approach to treating neuropathy. It can't be done with just simple medication or injection. Because there's so many factors that contribute to peripheral neuropathy, we really need to take a holistic approach to treat this. Some of the things that we do to treat neuropathy include light therapy, which stimulates angiogenesis, electroneurotherapy, which is going to repair and re-educate the nerve, metabolic management programs for blood sugar monitoring and balancing nutrition and eliminating heavy metals. They also work at balancing your body and your joint health. The fourth part of the neuropathy procedure is to test and see if there's a mechanical issue that's allowing this condition to get worse, like mine was. Sometimes there's a mechanical issue in the feet or knees or hips or even spine to make neuropathy worse. I always examine every facet that I can make sure we leave no stone left unturned. If during the exam it is determined that there is a mechanical issue on the x-ray or on our tests, that can be, basically we confirm that and then we figure out how to help it. All of these come together in our inclusive neuropathy treatment program. To start with, we evaluate you in the office and then put you on a tailored program that's just right for you, depending on many factors. Well, I hope you've learned a lot about neuropathy today, more than you knew before, and what you can do to help yourself. The key to helping a person reverse neuropathy symptoms is catching it in time. If you have suffered with neuropathy, you know it's progressive and degenerative, means it gets worse over time. Unless you do something to reverse it, it does not get better on its own. We do a neuropathy severity exam to determine how bad your neuropathy is. If you have more than 85% damage to the nerves, likely nothing can be done to help it. You just have to learn to live with it. At that point, it's too late. If you have less than 85% damage to the nerves in the feet or in the hands, likely we can help. Because neuropathy damages the nerves, most of my neuropathy sufferers start losing balance. We use Biodex balance testing, basically to test your balance. And this will show me that if you're having balance issues, what can be done to help. The first step in getting relief of your neuropathy symptoms is to find out how much damage there is. If you can be helped and want to look and see what needs to be done to reverse this debilitating condition, I recommend coming down to the office and talking to me. We'll do a consultation and we'll do the neuropathy severity exam to see if you can be helped and how bad the damage is. Now, if you've already booked a neuropathy severity examination, wonderful. I look forward to seeing you. If you haven't, you're in luck. I'm extending our new patient special to the next 5 years, so you'll save $450 on a comprehensive evaluation and consultation. So don't miss out. To book your appointment, give us a call Monday through Thursday, 9 to 6. Mention you struggle with balance issues, and we'll include a balance test with your examination, normally $150. Because we get a ton of interest in this program, our lines can get really busy. So if we miss your call, then there's nothing to worry about. We keep a record of calls made to the office, and places will be allocated for the first 5 that call us. So be sure to reach out as soon as you can, and we'll return your call. I really look forward to seeing you and helping you to get started on a new patient journey towards health, getting rid of your neuropathy symptoms and getting your life back. Thank you.